Top do's and don'ts if you're trying to conceive. Hi, friends. I'm Dr. Natalie Crawford. I'm a board certified OBGYN and RAI. Today, I'm talking about my top do's and don'ts if you are wanting to conceive. First of all, I just want to say thank you so much for watching and helping grow this channel. I love all of your support. So please subscribe and share so that we can talk more about your body, your fertility, your health, and you can learn a little bit more. There are so many common misconceptions and really just facts that you may not know. So we're going to go through some of my top lists. So, top do's, top don'ts if you're wanting to conceive. Top do number one. That's going to be track your cycle. And it doesn't have to be as detailed as you think. Meaning, I want to know are your periods regular? Remember that your period is a vital sign. It should be occurring at a regular, predictable interval. This may not be the perfect 4 weeks or 28 days, but for you, it should be within a couple days every month. So maybe it's 25, 26 days, maybe 27, 28, maybe 31, 32. We tend to feel like the acceptable range can be from 25 to 35 as long as it's the same for you. It shouldn't hop around from 25 1 month, 32, 27, 38. That is what I consider irregularly regular and a sign that something could be wrong. If your period is irregular, you need to go see a doctor before you start trying to get pregnant. That's a sign that something is up with ovulation, could be hormonal, your thyroids, PCOS, pituitary gland, low ovarian reserve, can be a lot of different things. So, number one, know when your period is happening. My first don't is actually don't use the wrong type of lubricant. So this is so interesting, and every time I talk about lube, people are always surprised. But when it comes to lubricant, there's a lot of marketing at play. Number one, no lubricant is going to improve your fertility. Your natural lubricant is going to be the best. That being said, sometimes sex can be uncomfortable. Sometimes there's medical reasons why you might have more discomfort or dryness. Even medications like Clomid might make you drier where you really do need lubricant. Of course, you have to get the job done in order to get pregnant. So if you need lube, it's important to know the right kind. But many lubricants will say, will help you get pregnant. And that's not true. All lubricants do have some impact on sperm, and that makes sense. We're asking the sperm to swim through an additional barrier that they otherwise wouldn't have to. So, of course, there's going to be some impact from that barrier on their ability to move and get where they need to go. What's very interesting is saliva, actually the very worst. 50% decrease in sperm motility with saliva. What we have to remember is that with a lot of commercially based lubricant, they're made for the female partner, and the vagina is very acidic. However, the ejaculate is quite alkaline. This means the pH of the two is very different. That's why sperm is even in the ejaculate to help protect it from the acidity of the vagina. So if you have a pH lubricant that's based vaginally and acidic, which many of them are, that is going to be more toxic to sperm. We tend to see that water based and silicone based lubricants are more toxic to sperm than oil based. So, what you're looking for is an oil based lubricant with an alkaline pH closer to 7 to 8 to be more appropriate for sperm. And so, oil based is going to be the preferential one over others. But again, no lube is best. So if you don't need lubricant, please don't go think that lube is a fertility treatment or something that you need. Number two, do if you're trying to get pregnant, is going to be take care of yourself. Do get enough sleep. Do eat enough calories and the right type of food. Do take care of your body and move it. Remember that we are trying to convince your body that this is a time when it can be pregnant. And so, what we don't want to see is that you're stressing your body out unnecessarily. If you're wanting to be pregnant, take care of yourself. Probably the easiest and the thing that people don't do enough is get enough sleep. I want to see you getting at least 7 to 8 hours of sleep every night. And whatever you need to do to prioritize that. Maybe you need to sleep later. You probably need to go to bed earlier. You need to set your sleep environment well, meaning you need to put your phone over there and you need to darken the room. Get up when you get up and see morning sunlight. So do take care of yourself. My number two, don't have less sex. There's this idea that you need to save up sperm so you'll have more sperm available when you're having intercourse, and that is false. No study has shown that having less intercourse has resulted in an increase in pregnancy. If you are in a relationship where you have frequent intercourse and you have intercourse daily, you can just have intercourse daily. You don't need to try to time intercourse with ovulation because if you're having intercourse daily, you're going to hit the ovulation day. You're going to hit the day before. You're going to hit 2 days before that. Remember that when you ovulate, that egg is being released into the fallopian tube and it only lives for 24 hours. That sperm has to swim up and fertilize the egg within that 24-hour time period. Now, one of the advantages is that sperm can survive in the reproductive tract for up to 5 days. So, if you're only picking one day on the calendar, we're going to pick the day you ovulate if we know when it is, or the day before. Those are the two best days. But when you save up sperm, you're actually getting a lot of dead sperm and debris in the ejaculate. And the analogy I always use is to imagine this is like a highway. And if we have a lot of stalled cars and accidents on the highway, it's going to be harder for the good sperm to even get where they need to go on time. So do not save up in an attempt to have more sperm. You can have sex every day if you're everyday sex people. One of our concerns is that if you're not sex everyday people and now you are, what could be happening is that you might burn out before that ovulation day. So if you are just trying to get pregnant, maybe you're not sex everyday people, having sex 2 to 3 times a week is going to cover getting sperm there close enough to ovulation. And if you're tracking ovulation with an OPK or with any of the other methods, you're trying to target the day before and the day of ovulation, but don't have less sex on purpose. Don't save up the sperm. My next do is going to be please do take a prenatal vitamin. We see a lot of push that some prenatals are bad or that you don't need vitamins or that you should get all your vitamins from your diet. What has happened is that a lot of our dietary foods have been supplemented with certain things that are needed, like folic acid. But now we see people consuming less folic acid in their diet. So refined carbohydrates have had added folic acid, like your breakfast cereals, for a really long time. But people are eating less of those. We also see a lot of prenatals with not folic acid in it. And this is always a big debate between folic acid and methylated folate. And here is my quick to the chase. Studies that have proven to protect your baby's brain and spinal cord against neural tube defects include folic acid. And that includes people who might have MTHFR or who might not. Meaning, we see a lot of people getting diagnosed and getting put on designer prenatals that don't have folic acid. But that's the only thing studied to prevent a neural tube defect. We're never going to see a study come in and counter that because that's such a serious outcome. But what's good for your baby might be different than what's best for you. And I tell patients this all the time. Maybe this certain type of thyroid hormone makes you feel the best, but it doesn't have what crosses the placenta. Same thing here. If you are on methylated folate and that's what you like, just take an additional folic acid pill. The idea that that's going to build up and be toxic in your system is false. And it's really important to protect your baby, especially the neural development. And my number three, don't, is don't expose yourself to unnecessary toxins. Things like marijuana, cigarette smoke, alcohol, these all are going to decrease your chance of conceiving, increase the risk of DNA damage, miscarriage. If you are trying to optimize your chance of success, have the easiest journey possible, you're going to want to limit exposure to these. Marijuana, even in male partners, has been shown to be associated with an increase in miscarriage in the female partner, even if she's not around when you're smoking it. What does that mean? It's not the smoke, it's actually the damage that's happening inside the DNA of the sperm. So it takes two to tango, good sperm, good egg. So we want to avoid unnecessary exposure to toxins for both people. So look at what's in your kitchen, what you're putting in and on your body, and please be really careful about unneeded toxins during this time because I want you to have the easiest journey ever. Did any of these surprise you? These do's or don'ts? Would love to hear in the comments and would love to see what fertility myths that you're hearing out there that I can answer for you. As always, so thankful for you. Please subscribe and follow along, share, and you can always follow on Instagram at Natalie Crawford MD or learn more on the As a Woman podcast. Thanks, friends.